Sleep is a part of everyday life for humans and is one of the basic needs that are required for survival.
Sleep in humans have been broken into two main categories: rapid eye movement sleep, also called REM sleep, and non-rapid eye movement sleep, also known as non-REM sleep. Non-REM sleep can be broken down to four substages. Sleep patterns are normally measured by an electroencephalogram, also known as an EEG. When we are awake, two patterns of activity occur, the alpha and beta activity. When non-REM stage 1 occurs, EEG shows theta activity. Stage 1 is the transition between awake and the beginning of sleep. Stage 2 of non-REM sleep shows the combination of theta activity, sleep spindles, and K complexes. Stage 3 and 4 are made up of delta activity, and these stages are known as slow wave sleep. Stage 4 is the deepest level of sleep, and if awoken in this stage, we tend to act confused and hazy. REM sleep is a period of desynchronized sleep, where theta activity occurs in combination with a very high frequency of gamma activity. In REM sleep, our bodies are paralyzed, but at the same time our brain is very highly active. If someone wakes up during REM sleep, they are highly likely to recall what dreams were occurring and they will appear alert and active. Different patterns of functioning also occur between non-REM and REM sleep. We will later discuss how these patterns in sleep affects our moods and emotions. People will vary how much they sleep. The average person needs about 8 hours sleep per night. However, some people function with 5 hours and others may need up to 10 hours. The severity of the effects of sleep, amount and quality one gets is dependent on how well we can function in our daily tasks and responsibilities throughout the day. Good sleepers take usually less than 30 minutes to fall asleep and may wake up between once or twice a night. Optimal sleep patterns require the alternation of non-REM sleep, which comprises of 75% of total sleep, and REM sleep, which usually comprises of 25% and lasts for about 5 to 30 minutes each 90-minute cycle. Slow wave sleep will be more prominent in the earlier part of night, while REM sleep will be more prevalent in the later part of night. Our circadian rhythms help us regulate our daily sleeping patterns. A generally accepted definition of happiness is happiness as a brief state of mind where an individual may feel when their needs are fulfilled and goals have been reached, such as joy and bliss. Happiness is usually expressed through our emotions and moods. Happiness facilitates our social interaction through the way we behave and our facial expressions. Sleep is shown to affect our emotional regulation, emotional memory consolidation, and emotional memory coding. This is seen to affect our amygdala, hippocampus, medial prefrontal cortex, and other areas of the brain. Sleep disorders are divided into two main categories: dysomnias and parasomnias. Dysomnias are defined by disturbances in the amount of sleep, the timing, and the quality of sleep. Dysomnias include primary insomnias, primary hypersomnias, narcolepsy, breathing-related sleep disorder, and circadian rhythm sleep disorder. Parasomnias are defined by abnormal behavior and physiological events during sleep. These include nightmare disorder, sleep terror disorder, and sleepwalking disorder. Sleep has also shown to be prominent in mood disorders and anxiety disorders. These include major depressive disorder, bipolar disorder, general anxiety disorder, and post-traumatic stress disorder. Treatments that have shown to be effective with helping with sleep include psychotherapies, medication, and other approaches. Earlier, I spoke to a sleep specialist who gave me a perspective on their specialty in sleep.
Well, I'm Dr. Grant Wilson. I'm a physiotherapist here at the Sleep Clinic at the University of Canberra. And at the university here we undertake the management of sleep disorders and the diagnosis as well. The main condition that we're looking at is a condition called obstructive sleep apnea, where the airway blocks at night. Obstructive sleep apnea causes the person to have little wakefulness periods throughout the night, only lasting about 5 seconds. So the effects of sleep loss can therefore be engendered by this condition, so that people can wake unrefreshed, they feel tired during the day, they lack energy or motivation, for example. Indeed, some of the patients have symptoms very close to those of people presenting with clinical depression. So we undertake sleep studies, and here's our guy set up for his overnight sleep study. This is a type of sleep study that's designed to be done at home. The patient takes the kit home, puts all the electrodes on. So that is just a brief introduction to what we do, a day in the life of the sleep clinic here at UC.
I hope you've enjoyed this multimedia presentation. If you would like any more information, please check out the link below. Good night.